website. Let's begin right away with our opening remarks, and we'll go to Mayor Ed Holder.
Well, thank you, Dan, and good afternoon, everyone. I'd like to start on behalf of all Londoners by offering our deepest sympathies and heartfelt condolences to the families involved in last Friday's tragedy at Dukelow Terrace. It's just too sad, too close to Christmas. And I want the families to know this, how much this tragedy has touched everyone in our community. And we offer our thoughts, all our prayers, and our support emotionally and financially. You're not alone. Londoners are thinking of you, and our community wraps its arms around you. I've spoken several times with Ontario's Labour Minister, Monty McNaughton, and he has assured me that no time nor effort will be spared as part of the investigation of what happened, how it happened. This investigation will be thorough, and it will be completed to the highest standards. I also want to acknowledge all of our first responders, our frontline workers, our hospital staff, emergency management team, and all those and our supporting agencies for the swift action and the truly unwavering commitment to serving our community in the wake of this tragedy. A couple of things I want to touch on today. One, this is our first day under our red COVID restrictions. As I said last week, first and foremost, all of us need to support local, small, licensed businesses like never before. Think of how many times and how many ways they've been there for us over the years, and now it's time that we show up for them. So, aside from the usual advice, I strongly urge everyone to do their holiday gatherings or parties virtually this year. Use Zoom, use FaceTime, but it's absolutely critical to avoid even greater surges than we've seen recently. And last, I want to revisit some comments I made in last Thursday's news conference when I was asked my thoughts as to why visible minorities in London represent almost a third of our COVID case count, despite making up 17% of our total population. There was a report referenced, and I wasn't particularly familiar with the report. And in answering that question, I will tell you, I gave a somewhat rambling and clumsy response. But I was thankful I was able to expand on that answer in a subsequent interview, although I want to reiterate those points during this broadcast because it's important, and there can be no confusion. We know, thanks in part to the report, the reasons for this overrepresentation are vast, complex, and many. Things like working jobs and essential services, which makes working from home extremely difficult, if not impossible. That in part plays a role. So too does living in crowded households, pre-existing health conditions, barriers to accessing various forms of care, economic advantages, and truly the list goes on. Those are messages that are extremely important for all Londoners to hear, to understand, and it's even more critical that we put this data to work by identifying ways we can improve outcomes and remove barriers currently being faced by members of our BIPOC communities. My actions when it comes to support for these initiatives at London City Council and the London Police Services Board speak for themselves. And while actions matter, so do words. So I chose mine somewhat loosely last week, and for that confusion, I apologize. These are conversations that truly matter and will make a difference in our community, and I'm grateful that we continue to have them, and we will continue to do this important work together. Over to you, Warden Cathy.
Great, thanks very much, Mayor Ed. And I too want to begin my words today with sending out, on behalf of the County of Middlesex, our thoughts and our condolences to the victims and families involved in Friday's tragedy. You know, our communities are not large, and I can share with you that there are connections to Middlesex County with those that were involved with the tragedy on Friday. And so we share the concern and that our neighbors in London share as well. I want to acknowledge all the first responders who attended the scene. We are once again reminded of how incredibly well served we are. And as the service provider for ambulance, I want to specifically mention our paramedics. I've had numerous conversations over the weekend with our chief, and he praised not only his team, but acknowledged how well all the first responders worked together. In this circumstance, thank you really seems so inadequate, but on behalf of the county, it is said with deep appreciation and respect. As the mayor referenced, we are in the red zone as of today, and to put it quite bluntly, it sucks. I have heard from a number of county residents and businesses who are deeply concerned on a variety of levels as to where and why we are where we are. And I share these concerns, but we are here. So we must continue to be vigilant and adhere to the restrictions. We need to think about how we gather. We need to rethink our holidays. I would ask at this time that you consider the mental well-being of neighbors and family members who may experience further isolation and heightened health problems because of how we are living. Holidays always trigger stress, and on top of a pandemic, we need to look out for others. Consider calling a neighbor to do a grocery run for them. Pick up an extra coffee if you're going through the drive-through and drop it off to a friend. Call someone just to chat. There are many community resources to assist those in crisis, and all of that information can be found very easily through municipal websites. If we don't look out for each other, who will? So remember to be physically distant, be virtual for your holidays, wash your hands, stay home if you are ill, mask up, but above all, be kind. And Dr. Mackie, we're looking forward to hearing from you now.
Thank you very much, Mayor Holder and Warden Burghardt-Jesson. Very grateful once again for your support and leadership. Thanks also for mentioning the tragic events on Friday. Obviously, very sad for many in the community. Unfortunately, we saw
including being under work quarantine and a number of other efforts. In the meantime, though, for our community, please please do not delay seeking care for urgent health concerns. Our emergency departments remain open and safe. Thank you again for having me, and I guess I'll pass it to Dan.
Thank you, Dr. Dukelow, Dr. Mackie, Madam Warden, and Mr. Mayor. All right, we do have a lot of questions, so let's get to them right away. Dr. Dukelow, a couple for you from Jennifer Beeman at the London Free Press. First question, Dr. Dukelow, how is COVID-19 testing going at University Hospital? Is LHSC embarking on a new round of prevalence testing?
So we did prevalence testing of the entire building. So it was 3,000 or 4,000, or I think it was 3,800 staff members and physicians and patients as a bolus earlier on. And then over the weekend, we've done another round of more focused prevalence screening. Those working in the outbreak units are being tested every 3 to 4 days, as are the patients. So at the current state, there isn't a plan at this point in time to do blanket testing of all of University Hospital. We're still considering all options.
Thank you, Dr. Dukelow. And a follow-up, the growth in cases among staff and patients appears to be slowing. And as you mentioned, no new cases today. Do you think LHSC is beginning to turn a corner on the University Hospital outbreaks?
Thanks, Dan, and thank you, Jen. I do think we are seeing signs that we're turning the corner, but like I mentioned in the preamble, but by no means are we out of the woods, and we remain laser focused on continuing to contain the outbreak and actually to get out of the outbreak so we can go back to more of a pre-outbreak normal.
Thank you, Dr. Dukelow. And Jen, we know you've got some other questions in there. We're going to come back to them. We're going to move down to Steve Young at CTV and News Talk 1290 CJBK. Question, Dr. Mackie, for you. Steve asks, given the rise in case counts, how long is it taking to complete contact tracing? Is that length of time still effective in slowing the spread?
Thanks for the question, Steve. We're able to maintain over 90% of case and contact tracing within the 24-hour window that is the standard of care. Very happy that we've been able to do that, and it's only through heroic efforts of the staff that are working on those teams, as well as the support of City of London, who have provided some staffing for that. We've also streamlined that entire operation so that it is very much a factory model, which with the cases and contacts broken down into their component parts in terms of who does what. That we believe we will be able to continue hitting that 90% by 24 hours mark, up to in the range of 90 to 100 cases per day. So at the moment, things are holding out.
Thank you, Dr. Mackie. Let's go to our next question. And this begins to start on a topic that we're going to see a lot in the questions this afternoon. Jane Sims at the London Free Press. And I think this is a question for Dr. Mackie. Jane says, Toronto PSW received the first COVID vaccination in Ontario today. When is the first shot here and who will get it? What does the rollout look like locally after that?
Appreciate the question, Jane. As you can imagine, there are an enormous number of healthcare stakeholders that are working closely together. LHSC obviously playing a major role in that work to make sure that a vaccine campaign is implemented as smoothly as possible and as efficiently as possible when we do get vaccine. The indications are that we should have vaccine over the next few weeks. We don't exactly have details at this point of how much or where. We do anticipate that the Ministry of Health will announce those details in the coming days.
Thank you very much. Let's go to Kelly Wong now at Global News Radio, AM 980 CFPL. Kelly asks, Dr. Mackie, the holiday season is upon us and the region has shifted into the red tier as of today. What concerns do you have about malls and how busy they can get?
We certainly have seen concerns around malls. The issue is really around those sorts of environments, even though you might have a number of people in the facility that can physically distance appropriately. They don't always choose to do so. So the lineups outside of stores, for example, or other places in the mall can become places of congregation and of spread. In general, that sort of environment is relatively low risk. You need to have more than a brief casual encounter with someone to pick up the virus. But if you are standing in line with someone for some time, then you may see spread. The other place where retail in particular has been hit in a number of settings is around staff to staff spread. People that do spend more time together for more prolonged periods and might, relax on breaks together. That sort of thing is definitely happening. And the cases that we've seen linked to malls at this point have all been staff cases.
Thank you, Dr. Mackie. We've got a follow-up question from Jane Sims, and I think this may be for both Dr. Dukelow and Dr. Mackie. I know we've already answered half of this. Jane asks, can we get a breakdown on the new cases today? How many were associated with the UH outbreaks? As we've said, none. Also, how many patients are in London ICUs? Gentlemen, do either of you know that number?
Well, let me say a few things about the cases today, and happy to pass over. Majority of cases from today are close contacts, and particularly family members of those who have been infected. A handful of those cases, about 11 or 12 are amongst students, but generally have a link at home with somebody who is sick there, and we don't suspect any of them to have been acquired in school. Beyond that, very small number continue to trickle in terms of travel-related cases. It's usually 3 or less per day, and then very happy that we saw our first day with no cases out of UH. Clearly, it doesn't mean things are over, but it is a good sign.
Just to pick up on the ICU piece, as of a few hours ago, there were 5 COVID inpatients in our ICUs.
Great. Thank you very much, gentlemen. Let's go to our next question. It's a 3-part question. It's from Kelly Wong. I don't know, Kelly, if you're hearkening back to the days of the 3-part questions early on in the pandemic, but here we go. Dr. Mackie, in terms of the COVID-19 vaccine, has the health unit discussed rollout plans with the province? If so, when might the first doses arrive in London and Middlesex, and what's the distribution plan across the region?
Yeah, I mean, health partners are all working closely together on that. We will be looking to the ministry to make the announcements about the details. We hope the vaccine and expect that the vaccine will be here within days, if not weeks. The first shipments we know will be, smaller than anyone has hoped for. And so we do expect that they will likely go to those priority groups within healthcare that are providing care to those at higher risk, and that we would have larger doses available, larger dose numbers available in January for some of the other groups.
Thank you, Dr. Mackie. Let's go to, we're going to go back to Jennifer Beeman. She's got a couple of questions about vaccines for both Drs. Dukelow and Dr. Mackie. Jen asks, Dr. Dukelow, Dr. Mackie, the province is aiming to distribute vaccine doses to 14 hospital sites in red and gray zones by year's end. Is LHSC anticipating it will be one of those sites? Does it have the ultra cold storage necessary? Dr. Dukelow, I'm thinking that's more towards you there.
Yeah, what I can confirm is that LHSC will be participating in this process, as Chris had mentioned earlier, and we are in the process of obtaining some ultra low storage, as well as potentially looking at repurposing ULT freezers that we have for other purposes like research.
Right. Dr. Mackie, the next follow-up question. Healthcare workers are prioritized for the early vaccine doses arriving in Ontario. Will staff at University Hospital be prioritized? So Dr. Mackie and Dr. Dukelow, do we have that information at this point?
Well, you could certainly make an argument that sites that are in outbreak should have first access, because that could potentially help control the outbreaks there. The reality is that the fine details of the rollout plan will likely be scripted fairly carefully at the provincial and federal level, and of course we'll abide by that and implement them when we get them.
Thank you, Dr. Mackie. Dr. Dukelow, do you have anything to add? All right. Okay. All right, let's go to the next question. This is from Jordan Reed at CTV London. Dr. Mackie, hundreds of people flocked to Victoria Park for skating on Friday. ahead of the new restrictions tightening in the city on Monday. What does this say? Are people not taking restrictions seriously enough?
Well, I mean, on the plus side, the outdoor activities are relatively low risk. On the downside, when you do have that many people together, you certainly can see the risk accumulate. You know, if you have, more than one person, for example, in that crowd that is positive, you've got the higher amount of vaccine, and you may start to see transmission at that point, even though people are outside. One of the positives that I'm seeing with some of the skating outside is that some people are wearing masks for those. I think that's a good thing in terms of protection, and also helps to normalize the use of masks, even when involved in low and moderate physical activity. You can wear a mask and go skating, and that will help protect you and others. Clearly, we can't see those skating rinks with 150 people on them. It's not safe. I thought it was great that the city was able to intervene and make sure that the rink was wound down on Friday night when the numbers got too high. So thanks to our city partners for being right on top of that.
And Dan, I'd like to just add as well, just for the benefit of the public knowing, that public skating at arenas is going to be postponed as from today until December 21st, when we're going to put new restrictions in place. And separately, the issue at Victoria Park, the skating capacity there will be limited to 25 people at a time. So to accommodate that, skaters are going to enter an enclosed area at the start of an hour and be allowed to skate for 45 minutes. At that time, the users will then be asked to leave the ice, allowing the next group to then skate for the next almost hour. So that's the most current information with respect to Victoria Park.
Thank you very much, Mr. Mayor, and thank you, Dr. Mackie, for that information. Very helpful for folks who are hoping to enjoy the winter outdoor activities that we all enjoy so much. Dr. Dukelow, the next question is for you. It comes from Steve Young at CTV and CJBK. Dr. Dukelow, are staff on the floors where there are outbreaks having to stay in area hotels? If so, is this mandatory?
That's a great question. So I had mentioned earlier that staff on the medicine floors that have an outbreak are in a work quarantine situation. So really the only place they can go is to work or to urgent medical appointments, and then they're to go home. They've also been instructed by the health unit to attempt to isolate from their own family members within the home. So they may still be living at home. For those situations where there are challenges with work quarantine or other people in the house that may be high risk, LHC is providing hotel rooms for some staff in order to support them as we go through this challenging time.
Thank you very much. Jennifer Beeman, Dr. Mackie has another quick question. Dr. Mackie, is there a recent case or cases connected to a Fanshawe College residence?
There was a case that was a Fanshawe student. We're investigating close contact and exposures right now. A number of contacts were deemed to be high risk. At this point, we don't have any outbreaks to declare.
All right, thank you very much. And let's go to what is right now our last question. And it comes from Travis Dolany at CBC London. Dr. Mackie, we heard about a positive case at a childcare facility in downtown London today. Can you confirm that? And if so, is it part of today's case count?
Travis, I appreciate the question. Unfortunately, not able to confirm that at this point.
All right, thank you very much, Dr. Mackie. And a reminder that the case counts that are published as part of the dashboard that's updated every day on the Middlesex-London Health Unit website are a reflection of the previous cases, the previous day's cases. So it's not a running tally, it is where things stood at the end of the day, the previous day. So today's update includes everything that was up to the end of the day on Sunday evening. Well, that brings us to the end of our questions, and just over 3 minutes left before we actually ran out of time. So thank you very much, everyone, for your responses, for your insights, and for your information today. Thank you for joining us. We look forward to seeing you again during our next virtual media briefing that will be happening on Thursday afternoon at 2 o'clock. So between now and then, take care, and we'll see you on Thursday. So long.